Good day, everyone. My name is Simon Day, and I'm broadcasting to you from Durban, South Africa, from IAPB Africa. Today, we celebrate Africa Day. Africa Day is the annual commemoration of the foundation of the Organization of African Unity, which is now known as the African Union. This took place on the 25th of May, 1963, which is exactly 55 years ago today. Apart from the enormous political and economic challenges, Africa Day celebrates the African way of life, culture, art, the gift of music, and Africa's love for bright colors. So I think it's fitting today that we're discussing an African solution. I'd like to welcome all of our listeners for joining us today, and I'd like to commend you all. We actually have a record of 130 people who registered for this webinar, which I said, well, it's an IAPB record, and we are quite excited about this. Our current software allows us to have a capacity of 101 live listeners, but if we get this level of interest moving forward for other webinars, I think we would certainly look to increase that number. Currently, I can see we have 34 live listeners, but as time ticks on, I'm quite sure that number will go up. Just a note for anybody, there will be a video of this webinar, which we will put on the IAPB website early next week. So we would say if any of those listeners feel that this webinar would be useful to colleagues or anybody else who may not have been able to join, please do mention this to them, and they will be able to view a video of the full webinar early next week. We have two wonderful speakers with us today. We have Dr. Simona Manchiotti, formerly the eye health focal point from WHO AFRO in Brazzaville. She'll be speaking to us today as WHO AFRO eye health consultant, and she'll be speaking on the core competencies and the competency document itself. Also, we have Dr. Michael Gichangi, Head of Ophthalmic Services for the Ministry of Health Kenya, who also is a WHO AFRO eye health consultant, and he was very much involved in the editing and validation process of the competency document. Dr. Gichangi, from his perspective of a national coordinator, will be speaking on the impact that the competencies would have at the country level. Just some housekeeping before we kick off. We expect the webinar to last for about an hour, with the presentations taking 40 to 45 minutes, and after that we will have a Q&A. We ask for your questions. You'll see a chat box in the bottom right-hand corner of the GoToWebinar screen or bar, and we ask that you you type your question in there, but also that you just mention your name and your location, so we get a sense of where our questions are coming from. Also, you'll see a handout tab, and that is where you can download some of the visual content from this from today's webinar. All right, so with that, I'll introduce today's topic, which is the World Health Organization Regional Core Competencies for Eye Health Workers in the Africa region. So the majority of countries in sub-Saharan Africa face a severe crisis of skilled health workforce shortages that impedes the realization of universal health coverage, especially in specialized fields such as eye health. I'd like to refer to some human resources for eye health data from the IAPB Vision Atlas. Just quickly, the Vision Atlas is a compilation of the very latest eye health data and evidence. It's designed around two main sets of data, the estimates of the burden of blindness and visual impairment made by the Vision Loss Expert Group, and national level performance against key indicators laid out in the WHO Global Action Plan. Right, what we're looking at here is a box and whisker chart from the IAPB Vision Atlas, and it shows how the inequitable distribution of the eye health workforce is clearly apparent, with the majority of African countries experiencing critical eye health, critical workforce shortages. Globally, 57 countries failed to reach the minimum desired level of coverage of health workers, and 36 of these countries are in Africa. So if I can just give you a crash course in a box and whisker chart. If you can look at the first row of data, high income data. What we're looking at, you'll see the two small vertical lines on either side of that range are called the whiskers, and then you'll see a box in the center. Now, the whiskers on either side represent the total range of data from the countries included in that data set. The box itself includes the middle 50% of the data included in that data set. The gap from the box to the left whisker is the lowest 25%. The gap from the right-hand side of the box to the right-hand whisker is the highest 25%. So if we were to read the high income data set, we'd see that the lowest the number of ophthalmologists per population in the lowest country presenting is around 25. We could see that from the middle countries, we have we'd say about 50 to probably 90 in 50% of the countries presenting, and then we have some outliers which give us quite a broad range up until the highest point, which is over 150. Right, so that was just how to read a box and whisker chart. So the chart we're actually looking at is the number of ophthalmologists per million population, and this is for 190 countries that participated in this particular full data set. And when we look at the sub-Saharan Africa, we can see that it does lag behind all of the other regions. We can see that we have some countries starting who have 0 ophthalmologists, and the country presenting with the highest is presenting at around 20. What is worth noticing though is that almost the 25%, which is the gap from the lowest whisker to the end of the box, is probably at about 4 ophthalmologists per million population, which is particularly low. Moving on, we have a similar chart showing optometrists per million population, and this is taken from 128 countries. Allied ophthalmic personnel, data taken from 95 countries. And here we have a similar chart showing the cataract surgical rate, the number of cataract surgical operations per million, per year per million population. So the cataract surgical rate serves as a quantifiable measure of cataract surgical delivery, and it can be said that countries with a CSR of less than 1,000 almost certainly falling well short of the required number of cataract surgeries to prevent avoidable cataract blindness, and those with a CSR of less than 500 drastically so. And looking at this at sub-Saharan Africa, we can see a fair amount of countries within that data set are falling below 500. I'd just like to say, anybody who is interested in exploring this data further or other eye health data, please do visit the Vision Atlas. That can be located at atlas.iapb.org, and there really is a wealth of information related to eye health. Right, back to our topic. So in an effort to strengthen human resources in the region, IPB and WHO have been developing core competencies for eye health workers, which will inform training and quality of care by eye health professionals within the sub-Saharan Africa region. The result is a policy document entitled the WHO Core Competencies for Eye Health Workers in the Africa region. The development of the competency frameworks for different levels of the eye health workforce is a critical component of the IPB Africa HRH strategy with regard to improving the quality and relevance of care provided by professional eye health workforce, thereby contributing to universal eye health care. Given the shortage of human resources for eye health, and in line with the WHO approach to task shifting or sharing, this policy document contributes in a unique manner in providing competencies that can be delivered by a range of eye health professionals. Countries can select and tailor these core competencies to meet their specific country needs. The cadres in the eye health professional team may share some competencies, but others are unique to some cadres. The selected competencies can then be included in curricula, allowing the transformation of task shifting or sharing from the often informal delegation and unstructured training to producing a competent eye health professional who renders tasks that are within their role within country and professional regulatory frameworks. Team-based education is also in line with the WHO approach to interprofessional education and collaborative practice. At this point, I'd like to hand over to our first speaker, Dr. Manchiotti, who will speak on the competencies and the document itself.
Thank you very much, and good morning, everybody. It's a big honor for me to be here today with you in this important day for Africa, and also to introduce you to this new document, this policy document produced in close collaboration with the IAPB by WHO AFRO. As said by Simon, there is an important shortage of work phase. I hope you can see my screen in the correct way. There is a severe shortage of skilled health workforce that impedes the realization of the universal health coverage, especially in the specialized fields as can be eye health. And the reason why WHO accepted the call, the advocacy from IAPB on the specific topics is that, in effect, there have been enormous change in the vision of the needs, in particular for training institutions, to train the health professionals. So a change, a shifting from the standards way to train to a much more competency-based training that can reply in the correct way to the specific needs of countries and of region. And the shortage we are talking about is not only referred to Africa. We have saw from Simon's presentation that all the region have this important shortage. The problem is that in Africa, this shortage is much more important, and as said, in particular, for the specialized fields. And we have also to think about the burden of disease. In sub-Saharan Africa, there are around 5 million people that are blind and around 7 million people who are visually impaired. This is an important impact on their quality of life, obviously, but in particular as also an important impact, negative impact at regional and national level economy. And in the same moment, even the huge burden of eye health in sub-Saharan Africa, less than 1% of the ophthalmologists practice in this region, and only 30 countries in the region, we talk about WHO region, meet the minimum requirement of one eye health professional to 55,000 people. The other problem is that most of these professionals are located in the urban areas, while the major needs are in rural areas. That is the area where people need a major efforts in terms of prevention, in terms of diagnosis, in terms of treatment, cure, and also in terms of provision for rehabilitation. The shortage of human resources for health in general and for eye health, for this reason, at a certain moment, became an important topic for WHO, and it was also noticed that in the same time, there was not only the problem of the shortage of the health professionals, but there is also a limited capacity of the training institutions in all the different fields, but in particular on the eye health field, in training people to become good with a quality level of provision of services for people in need in the African region. This is why this document has been produced, and the document is in effect a policy document that provides the first step in the development of the competency-based education for people working in the eye health field, so for the eye health professionals, to reply in a correct way to the African region needs and to its unique challenges. I would like to let you know that the African region has been the first one to produce this kind of document. Before HQ, before other regions in the world, WHO and IAPB have been able, through a long process, around 5 years process, to produce a document that is the first of this type in the WHO framework. It's a reference document that can be used by, first of all, the training institution to review and to develop their own curricula for the eye health professionals, but can be also used by the ministries working on the management and planning of the workforce, by the regulatory bodies, and so on. We think that this document will contribute to a higher quality and harmonized way across the region, but also to the development of the capability of the training institution to train people with a good quality capacity, and also a way to strengthen the health system to support the eye health professional teams to execute the competencies acquired to provide the quality eye health care as a step towards the universal health coverage. So we are really honored to present this document to you for all these reasons, because we think that can be an important document to be used in the different countries and by the different institutions to improve the reply of the needs of population in the area of the eye health around the region. So as said, WHO, AFRO, and IAPB have worked really closely toward the harmonization of this role of human resources for health within a global framework and replying to global standards. We work together, obviously also working with a lot of national regional experts and also experts from outside the region and a lot of stakeholders. So it has been really a consultative approach to develop this document. The document is concentrate on the 3 skilled eye professional groups we have through a consultative process recognized to be the first target for the training institutions, the Ministry of Health, and so on. These groups are the ophthalmologists, the optometrists, and the big group of the allied ophthalmic personnel. In this group are grouped all the technicians, nurses, people providing services to people in need for eye health problems that with different names are recognized in all the different countries of the region. So what we tried to do was to really provide a broad concept for all the different categories recognized in the different countries. It's not important the name you give to the professional group. is important their competencies, so the minimum skills they should have to provide a quality healthcare service to people with eye health problems. Obviously, the target audience of the document are, first of all, the training institutions, but also the professional association, the regulatory bodies, the policymakers, for example, Ministry of Health and Ministry of Education, and obviously also the self-learners for eye health. How we produce this document, as said, was really a collaborative and extensive consultative process to develop the document itself. Eye health expert, trainers, different stakeholders have been involved in the process, that has been a really long process from 2013 to 2018. What we did after extensive consultation was an initially desk review, also to choose the kind of document to use as a reference documents of the work. So we refer to the international standard classifications of occupation in order to identify the occupational rules, and also some other medical education framework as the CAN MEDS. We proposed through the work of a consultant, that is Dr. Gichangi, that then will present you the impact that we think this document could have at national country level. We produce different drafts of the document that have been reviewed by a group of experts from Anglophone, Francophone, and Lusophone African countries through 2 nominal meetings, several e-meetings, and also through 2 rounds of Delphi survey. Each of these activities, so the meetings, the e-meetings, the Delphi survey, all the inputs, findings received have been obviously embedded in the draft we were producing on the way to arrive to the last version that has been validated in a workshop held in Nairobi from 2017 February to 1st of March, involving a wider group of experts, but also representative of African member states, in order to analyze the document, to evaluate the concept in the document and the way it shows up, the review of the whole process, and to finally validate the document in the way it is today. The document presents so a comprehensive set of core competencies, minimum core competencies that the workforce should have in order to be considered valid and good to provide quality services to people in need for eye health problems. The document and the framework is divided into 10 domains, 4 clinical and 6 non-clinical domains, and each of them is then divided in relevant knowledge, skills, and behavior. Only to give you a broader idea, the 4 clinical area or domains are the non-surgical care, the surgical care, the preventive and promotive care, and the rehabilitative care. While the non-clinical domains are much more the different competency that the different groups can share. For example, the capacity to communicate, the capacity to train the new person, the capacity to advocate for the eye health, the capacity to manage colleagues, the capacity to work with other colleagues from other sectors or from different colleagues of the IL team, because the idea of these competencies is not only provide competency, clinical or surgical, but also to provide the different person in the IL team with the capacity to communicate with people around them, both the patients and families of the patient, but also the other person of different health sectors. Why this? Because we know that a lot of the IL patients are not only affected by eye health problems, but sometimes they are people with chronic diseases and they need to be treated from different sectors of the health sector. So it's important to start to understand that sharing information and work together with other areas of the health sectors is important, as it is important to directly diagnose, treat the eye health. What we try to do is really to put the ophthalmologist not more as a vertical, or the eye health professional, not only as people working in a vertical way, but really work together in the health sector and provide so a complete provision of quality care to the patient and to the family of the patient. And this complete provision of service goes from the clinical or surgical provision of service to the prevention, but also to the rehabilitative path. The IL professional have to become really open to the total part of provision of service. We can only provide clinical or surgical service and then think that the patient has solved his own problem. The patient has to be really follow from the scratch to the end, so to the rehabilitation. If it's impossible not to treat and to solve completely his problem, the system has it made for him. So to conclude, I say this is a policy document that in our idea contributes in a unique manner in detailing the competencies that can be delivered by a range of IL professionals. To be clear, is obviously a framework and a reference document. So that means that each country can select and tailor these core competencies to meet the country needs, the specific country needs, and can include these core competencies in curricula, producing competent IL professionals who render tasks that are within the role and within country and professional regulatory frameworks. So it's no more a standard, but I say there has been this shifting to skills that should be presented by the IL professional to consider them providing a quality IL service. And this is the scope of WHO and also of IAPB the moment we work together to call for high quality IL services, focusing on people-centered services, and also to focuses in order to have people-centered services to really work on an harmonized education on the health systems and to support networking and collaborative practice. It has to be clear in our mind that this document is an initial work, is really reference work to the country to then develop an adequate national IL workforce. The idea to standardize, not to standardize, but to harmonize, these competencies around the region is also a way in our mind to facilitate the reply to the people in need. That means that if some countries initially are not able to reply to the needs of the population, because it takes time, obviously, to develop its own workforce, having an harmonization around the region or the sub-region could help also in the initial mobility of some professional if requested by the countries from a country to another, because the level based on competencies will be the same. It will be possible to check if the competencies correspond. It will be possible so have an initial help if needed from health professionals from other countries to start or to fill the gap before its own health professional will be trained. So I hope that the presentation has been clear, and if there are specific questions, I will be more than happy to reply to them. And thank you again for the opportunity given.
Thank you, Simona, for your presentation. I think it was interesting that to highlight how this document has come about through broad collaboration from multiple stakeholders, which has resulted in a particularly comprehensive document. And also interesting that Africa is taking the lead on this process, in that other regions, including HQ, have not produced such a document in relation to eye health. Thank you to everybody. We have some good questions coming through. Just one particular note about qualities. There's a mention of an echo. We're busy looking into that. We'll see if we can improve that. I think we'll hold most of our questions until the end. But just two recurring questions with regard to whether or not content will be made available. So the Vision Atlas charts that were presented earlier, you can find those immediately in the handouts tab. And with regard to the presentation that has just been made by Simona, yes, we will share that after the webinar. So at this point, I'd like to hand over to Dr. Michael Gichangi, who will be discussing with us the impact that this document can make at the country level.
Thank you, Simon. I'll be brief, and basically I'm going to summarize. While I was greatly involved in compiling the opinion, the consensus of different persons and opinion from all over the world. While in developing this policy document, we aspire to achieve universal health coverage, and for that matter, universal eye health. And we noted that insufficient workforce in numbers and mix, and appropriate attitude and appropriate distribution, compounded again by limited training capacity in our region, stood out as key issues that are attributed to our suboptimal service delivery. Now, what we did, or what we seek to do on acknowledging these challenges, we have responsively identified core competencies for 3 cadres in eye health workforce. These cadres include ophthalmologists, allied ophthalmic workers, and optometrists. This is a first step, or a step forward, in adopting transformative approach to health professionals education. Now, I want to list out some of the expected effect or impact in different countries in the Africa region. And we believe that these competencies will guide development of curricula for training, as has been mentioned before. It will give clarity to tasks and roles defined for each cadre. It will enable standardization or harmonization of training programs, and this will also include accreditation by the different accreditation bodies. Hopefully, they will also motivate training institutions to develop and improve the training programs. We believe that the competencies will also help evaluate training programs, help to identify gaps in each context, in each country, a country and its specific issues. Now, these competencies should also be used by specific countries to customize interventions to improve their capacity. And above all, and in the context of continuous professional development, which is needed among the eye health workforce, we hope to entrench a culture of lifelong learning among the eye health workforce. Within the core competencies identified included an eye health workforce or an eye care provider who embraces lifelong learning. Now, for us to achieve or for this impact to be realized, it's good to realize that we did this, that these competencies were agreed upon among the relevant stakeholders, both in workforce development and in workforce management. And so we will continue to engage our stakeholders, and so that we remain relevant and also continue to improve in the context of our situation, that is Africa. We will actively disseminate the competency policy document as we are doing now and through other platforms as opportunities arise. Besides that, we'll also develop implementation tools and strategies that will help realize the effect desired of the competencies. And more important, we will seek to identify champions, especially within the professional bodies, in the implementation of these competencies. Ultimately, what we hope to achieve is to have a responsive, patient-centered, competent workforce for better health outcomes. And in conclusion, I would like to say that we have a policy document on core competencies for eye health workforce. It has been developed after wide consultations among the stakeholders, and this policy document is a baseline on which future actions to improve capacity for delivering eye health or achieving universal health can be made, especially in the context of professional medicine. Thank you very much.
Thank you, Michael, for your presentation. Thank you, Michael. Yes, I'd like to just say, leading on from Michael's presentation, there are with regard to the launch and implementation of the document, there are several activities that are looking to be planned to take this forward to help make that impact at the country level it's most effective. Just ahead of that, a question that came up was, can we share the core competencies document at this point? Unfortunately, we can't. This remains a WHO AFRO official document, and it's currently going through the editorial process. Only once it's received its final approval by WHO AFRO and has been published by them would it be available to the public. So unfortunately, at this point, it's not a document that can be shared. With regard to what happens once it has been published, this was discussed at the last validation meeting, and with WHO AFRO, we would be looking to have an official launch where there would be an event or a side event at one of the larger WHO AFRO or WHO HQ events where the document could be launched and ideally launched to a group of ministers. In the meantime, this document will be used. IPV has an activity whereby we are looking to harmonize the competencies, the competencies of the 6 colleges of ophthalmology of sub-Saharan Africa, and this would become the reference document for the harmonized curricula. We will be presenting on the core competencies at the upcoming COEXA Congress, which is taking place at the end of August in Ethiopia. And then once it has become a published document, IPB will be looking to implement national rollouts with countries. So thank you. I have a few questions from our audience members. Perhaps I can pose the first question to Simona. It says, do the core competencies within the optometrist, the competencies for optometrists include opticians? Because in francophone countries, it's often opticians who undertake this role. Can I hand that over to you, Simona?
Yeah, sure. So the opticians are in the AOP groups, considering the AOP groups. But as said, being core competencies based, obviously the country will decide exactly which kind of professional should have which kind of minimum skills, behavior, competency to provide the kind of work they want. So we divided the three groups to the way they correspond to the professional standards. But obviously then each country will link competencies to the different professional they want to train. So we tried not to create confusion, but to solve confusion. We divided the three categories. In the three categories we found that are optometrists as they are, and they are also recognized, and the opticians are technicians in such a way. But obviously the country then will keep the competencies they consider the correct one for the optician and will put that one in the curriculum. I hope it makes sense.
Thank you. Our next question is for Michael. So Michael, the question is from Dr. Patel, and it is, how many training institutions took part in the consultation process? Now, it might be difficult just to come up with a number of training institutions at hand, but perhaps you could just explain, Simona did cover this to a degree in her presentation, but as you were involved in the Delphi process, you coordinated the Delphi process and the validation process. Perhaps you can just touch a little bit on how broadly the Delphi process was extended, and just briefly how we selected the number of people involved in the Delphi process, and how we selected those to whom the Delphi process was extended. Michael, did you get that? Okay. Perhaps I can tackle that. We, amongst IPB and IPB Africa and the Working Group for Human Resources for Eye Health and WHO AFRO, we looked at a broad spectrum of eye health experts. And these included experts from professional bodies, from training institutions, from regulatory bodies, and cater experts as well. And so we understood that we couldn't get everybody into a room at the same time. So the Delphi, the core competencies were sent out as part of the Delphi process. And if I'm not mistaken, it was sent out to about 160 people. So it was very broad, and certainly that included training institutions. So Daksha, I don't have an exact number for you, but it did certainly go out. For the most part, I would say that those recipients were within the Sub-Saharan Africa region, but I don't believe that it was exclusively within the Sub-Saharan Africa region. We have a question from John Limo. Are there opportunities for e-learning on a continuous basis? To that, I would respond, these core competencies are not a curricula per se. They're a reference document that may advise a curricula, but that level of activity would, I think, be taken up with a particular training institution, and these are not being a curricula. It's not something that they would offer. Can I pose this question to Simona? It's from Terry Cooper of London, who's not Terry Cooper, whose question is coming out of London. Does the document talk about the possibility of AOPs, for example, OCOs, carrying out cataract surgery to increase CSR? Simona?
Simon, sorry, may I ask you to repeat the question because it was not clear. There was some cutting in the question and I didn't hear very well.
Of course. So I'll again slowly. Does the document talk about the possibility of AOPs, for example, OCOs, carrying out cataract surgery to increase CSR?
Okay, there are, but once again, is based on the decision of countries. Have been treated some surgical task shifting. Some of them have not been accepted by the audience through the Delphi rounds. So some of the surgical treatments are not part of the skills and competencies given to the AOPs. Others, one is cataract, is considered as possible, but is based once again on the decision of the country. It's not an imposition. All has to enter in the framework, national regulatory framework of the country. So there is, because in some countries it happens, but it doesn't mean that in all the countries will be applied. Once again, it's a list in this policy document, reference document, of activities that can be done by the different cadres in the opinion of all the experts consulted, but it doesn't mean that all the countries have to apply the entire list. It's on their own decision based on their own regulatory framework.
Thank you, Simona. Well, thank you. I think we've come through most of our questions. And to everybody, I hope that you've enjoyed this webinar. I'd like to thank you all for participating. And I do hope you enjoyed it. I'd like to thank our speakers, Dr. Manchiotti and Dr. Gichangi, for giving up their time and for giving us this webinar. I think, given the enthusiasm and the numbers that registered, it really is a topic that resonates with a wide audience, and there's a lot of talk whenever we attend events. There's a lot of talk about this document, and I think we're all waiting with great anticipation for it to come out. On the part of IAPB, I'd like to thank Emma and Teja for facilitating this webinar. It doesn't just come together by itself. They've really been great setting it up, scheduling it, and getting the communications out there. And I think the fact that we had such an overwhelming response is testament to the effort that they put in promoting it. I would certainly encourage everybody to look out for the next webinar, which again will come from those two as well, through the on part of Emma, our membership officer, and Teja, head of our communications team. On that note, I'm sure you've all been receiving a lot of emails from various sources regarding general data protection regulation. I would just ask you to remember to update your consent settings with regard to IAPB. I know we do send out a fair amount of content. We don't like to overwhelm you with content, but there certainly are really there's some great correspondence that we send out. And if you've not updated your settings, we won't be able to send it to you. So I would ask that you, perhaps if it's not something that you've done in recent days, go just in your email search, type in GDPR. That's GDPR, and you should have received an email from IAPB asking you to update your consent settings. So please do go ahead with that. Right, I think so. That's it from us. We've managed to finish within time. Thank you again to all of you for joining, to our speakers, and to our IAPB Global team for putting this all together. So thank you very much, and until the next webinar, goodbye.